You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. Joining us right now, folks, is Dr. Valda Crowder, an emergency medicine physician who has treated COVID-19 patients. Dr. Crowder, welcome to Roland Martin Unfiltered.
Hi, how are you?
Doing great. First and foremost, give people a sense what it looks like as you are treating people and dealing with them. Take us inside that emergency room.
Inside the emergency department. So I would say about half of the patients that I am seeing in the emergency department, and I work in a rural area, so about half of the patients that I'm seeing are COVID-19 patients. Their symptoms are ranging anywhere from like a mild bronchitis. People also get a stomach flu, like a nausea, vomiting, diarrhea. There are some people that are just very nervous and may just have mild sort of sinusitis symptoms. And then you have those that are actually really sick and having difficulty breathing and need more intensive resuscitation measures.
And what's crazy about this is that there are some people who are asymptomatic. There are others who are slightly ill, and others who get gravely ill. Some it happens in 3 days. Other it takes 2 or 3 or 4 weeks. I mean, that's what's so crazy about this coronavirus, COVID-19.
Yeah, so in Iceland, where they actually tested the largest majority of their population, the most per capita tests that were done, they found that 50% of the people that were COVID-19 positive were completely asymptomatic. One of the earliest signs of COVID-19 is a loss of your taste or smell. And then you have those that actually get extremely sick and short of breath. Yes.
So with that, and knowing full well in terms of this broad range, is it the fundamental problem still that right now, with all the touting about Trump and Mike Pence and all of them, that we still, frankly, have not tested enough people in this country?
We have not tested enough people. We are, in fact, I brought this with me. This is the diagram of what is needed, like the decision diagram for testing.
Whoa. Hold up. Hold that up again. Just back up from the camera and hold it up again. Wow. Okay, what is that again?
This is the decision tree that they gave me for determining whether or not a patient needed a test or not. So when I came to work last weekend, they handed this decision tree to me. I said, if you wanted me to actually follow this, I should have actually gotten this a month before I started working to actually really figure this out. And so because we don't have enough tests, there's all of these crazy algorithms, and everyone is testing differently. Every state is different. It is really, really a problem. And it's a problem in the communities, and it's also a problem in the correctional setting.
And so, with that huge chart there,
yes.
I mean, surely doctors are sitting here going, I can't go through this whole checklist and trying to go here, and here. And so what have y'all been saying to folks who put that out? Like, no, we're on the front lines. We're seeing it. This is how it should actually look.
Oh, no, I said I'm actually ordering the test based upon what I think the clinical parameters should be based upon what I've actually heard about this test. And I hope it falls within these parameters. But if it doesn't, someone can come down and talk to me about it. And no one wants to come down to the emergency department because they know that we're seeing so many COVID patients. They don't want to come down and talk to us about anything. So, they didn't say anything. But that is what they gave me when I actually first came to work.
Wow, that's kind of crazy there. And so, and what still bothers me, I mean, I saw that big old news conference in the Rose Garden, and we were going to have parking lot testing at CVS, Walgreens, and Walmart, and none of that's happened.
Yeah, none of that's happened. Yeah.
So, but is also the problem? Is it also a problem not only with that, but do we have enough testing centers? Like, for instance, so let's say if we all of a sudden started testing, 1 million people a day, do we have enough places to actually process the test? And because I'm hearing reports, I got a test, but I found out 12 days later. And then I was reading the other day where they were saying that Abbott has these tests, but these systems, these rapid tests, but not even being used.
Yeah, so we had a system to test that actually takes several days until the FDA approved a rapid test. So the FDA approved a rapid test last Friday. So for that rapid test, you actually have you have to have the testing kits and the proper equipment. So there is an FDA-approved rapid test, but it hasn't been yet rolled out to everyone. So that is the issue with the testing, and you are to stay quarantined until you get the results of your test. So I think even when we come out with a rapid test, I'm not seeing the infrastructure that we need to rapidly test the people that actually need to be tested the most.
Let me also ask you this. You have these daily briefings. You have Dr. Birx, Dr. Fauci. We don't waste our time with what Donald Trump has to say. Are they putting out the appropriate information? And if not, what should be coming out?
Yeah. So one is, I think what clearly needs to come out is that you can be asymptomatic and be COVID positive and give it to other people. There's a large percentage of people that are actually in that category. I think the other thing that should be coming out is that this can present with gastrointestinal symptoms. So you get nausea, vomiting, and diarrhea. It's not just respiratory symptoms. So if you're sick with either respiratory or gastrointestinal symptoms, you should know that you could be COVID-19 positive. The other thing that I think is really important is that people who have a home nebulizer for asthma, they should not be using their home nebulizer if they have an asthma attack. You cannot tell the difference between asthma and a COVID-19 infection. And then if you use your nebulizer, you've aerosolized it all over the house. So you need to either use it outside or inside use an inhaler with a spacer or aero chamber.
Gotcha. Okay. For those of us who are at home, we're not doctors. They're saying what we do. You've got allergy season. Now you've got this cold weather that's blowing through the Northeast. Now we thought winter was done, but now it's not done. And so if you're at home, what should you be looking for? One of my former colleagues, she had a fever for more than a week. Then she found out really it was a sinus infection. And someone else was tweeting about that. They started freaking all out. Same thing, a temperature spike. She also had a sinus infection. And so what exactly should we at home be looking for before we decide to try to go to an emergency room or try to call our doctor? What should we be doing?
Well, I would say one is if you actually get sick, the first thing is you actually want to, it's more likely that it's going to be something other than COVID-19, but because COVID-19 can be so deadly, you want to almost assume it is COVID-19 and call your doctor, use either a telemedicine or a telehealth platform and actually get a prescription to get tested. I tell people, really, you do not want to go to the emergency department unless you're really, really sick, like you're short of breath, you can't stand up, you can't walk. You really want to stay away from the hospital settings because if you're negative, there are positive patients in the hospital setting. So you don't want to expose yourself to something that you don't need to be exposed to unnecessarily so.
Got it. All right, then. Well, look, we certainly appreciate it. Thank you for the advice. I know it's crazy out there. And unfortunately, folks like you are on the front lines in this war and just trying to keep up every day.
Thank you.
Dr. Valda Crowder, thanks so much. I certainly appreciate you joining us at Roland Martin Unfiltered.
Fam, I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.